Okay, so today we're going to talk about central venous therapy. In central venous therapy, the drugs or fluids are infused directly into a major vein instead of in peripheral veins. It's used in many situations, and some of the reasons that a person would have central venous therapy is for emergencies. If they need an infusion of a large volume of fluid, peripheral veins aren't accessible. They have multiple infusions, long-term infusion therapy like chemo, or they need an infusion of very irritating meds, again for like chemo, and then infusion of fluids with high osmolality. So those are all things that would require central venous therapy. On page 82 in your book, there are the many benefits of central venous therapy. Again, allows access to central veins, a rapid infusion of medications or large amounts of fluids. You can also take blood samples and measure central venous pressure. You can reduce the need for repeated venipunctures, and that helps reduce the patient's anxiety as well, and it also preserves those peripheral veins. It reduces the risk of vein irritation from infusing irritating or caustic substances. So preserving peripheral veins is important because you may need to do something else with those. But central venous therapy, because many times the line has more than one port, you can infuse things into it. You can have regular fluids going. You can put antibiotics through it. You can use another port just to do blood draws. There are many different reasons. It's very beneficial to the patient. The risks, as with anything, there is a risk because it is an invasive procedure. So some of the complications then are pneumothorax, sepsis, thrombus formation, perforation of the vessel and adjacent organs, and then there are disadvantages. It requires lots of time and skill. It costs more to maintain. It carries the risk of air embolism, and it has a greater risk of infection. It's a larger device, so has a greater portal of entry. Now, some of the things that you need to remember and think about with venous circulation. And remember, the adult body has normally 5 liters of blood, and it delivers all the oxygen and the nutrients throughout the body. So, peripheral circulation then, or venous circulation, comes from the head, the neck, and the arms into the superior vena cava from the jugular veins, and then from the subclavian vein and right and left brachiocephalic veins. Returns from the legs into the inferior vena cava, and everything goes into the right atrium. You don't have to know that for this part of the quiz, but it's good just to be thinking about that when you're thinking about this line that somebody has in them. So you remember how the blood flows, but it's not something that is necessary for you to know for this quiz, okay? So a central venous therapy, catheters inserted into either the superior vena cava or the inferior vena cava. Blood flows around that catheter at about 2,000 milliliters an hour. That's a lot of blood. And there are various types of central venous catheters also. They're non-tunneled, tunneled, PICCs, which is a peripherally inserted central catheter, and a port. Okay, so you will need to know those different types of catheters. Next. So non-tunneled catheters then are radio-opaque, and they can be placed by an X-ray. They are directly placed into the subclavian vein and advanced into the superior vena cava. They're usually designed then for short-term use, such as a brief continuation of IV therapy following a hospitalization. So if the patient's going to go home, have home health, but still needs antibiotics infused into them on a daily basis, then they're going to have a non-tunneled central venous catheter. And they do require then frequent monitoring. They're changed according to facility policy, so wherever you work, you need to know that. Current standards recommend only changing the catheter when there's evidence of local or systemic complications. If the insertion site appears red or infection is suspected, you're going to stop using that access device as soon as possible and use an alternate site. Okay. Tunneled catheters are also radio opaque. They are designed for long-term use though. Silicone is much more physiologically compatible and therefore minimizes the irritation and damage to the vein lining. On page 85 are the reasons that you would use a tunneled catheter. It's much better suited to home care patients because they're designed for the long-term use. Also for patients who have poor peripheral venous access or who need long-term daily infusions, like patients with cancer, AIDS, some kind of intestinal malabsorption, anemia, transplants, bone or organ infections, and other chronic diseases. And you can give many types of medications through a central venous catheter, tunneled catheter, such as antibiotics, chemo, TPN, and then blood and blood products as well. There are several types of tunneled catheters, including the Broviac, the Hickman, and the Gershon. They also come in the single lumen, double lumen, and triple lumen, or multi-lumen, and those are the number of ports that each one has, and they vary in size also. The Broviac has the smallest lumen, which is just the diameter of it, and it's a good choice for people with small veins, especially a child. On page 87, it talks about the different kinds of catheters, and you've got a picture of what the Gershon and the Hickman and then the multi-lumen catheters look like as well, and then there is a single lumen also. So keep those things in mind. You don't necessarily have to know that, but to know that there are different in the way that they look, and know what some of those differences are as far as the lumens go. So again, a PICC line is a peripherally inserted central catheter. It is the most common. It's known as a long arm or a long line catheter. It's inserted through a peripheral vein and threaded into the superior vena cava. Normally, in the arm above the AC is where it is threaded, and then it's threaded all the way through into the superior vena cava then. The catheter tip is located then in the superior vena cava. If it's outside the vena cava, it's not considered a central catheter anymore, and it should be removed. So generally, PICC lines are used when patients need infusions of caustic drugs or solutions. And they're especially useful if the patient doesn't have reliable routes for short-term IV therapy. You choose a PICC when a patient needs therapy for 5 days to several months or requires repeated venous access, and a PICC line is the way to go. Then it's especially for a patient that's had a chest injury due to trauma, burns, or respiratory problems due to chronic obstructive pulmonary disease or other conditions. Using that peripheral site for a PICC helps prevent complications such as the pneumothorax that may occur when the central line is inserted into the chest. So there is an advantage to it. So PICCs are also used, and they're common in patients that have AIDS, cancer, recurrent infections, sickle cell anemia, and women who have long-term IV therapy because of severe morning sickness. You can get analgesics, antibiotics, blood products, chemotherapy, immunoglobulins, opioids, and TPN via the PICC line. And PICCs again come in the single, double, or triple lumen configuration. And guide wires don't mean anything to you, so you don't have to worry about that part. The catheter gauge depends on the size of the patient's veins and the type of fluid or medication that's going to be infused. PICCs range in size from 14 gauge, which is huge, to a 24 gauge. And they're normally between 7 3/4 inches to 23.5 inches long. And then you have other ones that are configured for neonates. If the patient's going to have blood or blood products, remember you have to use at least an 18 gauge in this situation. You are not to use a tuberculin syringe or a 3 ml syringe with a PICC line for any kind of medication or flush. The smaller syringes create too much pressure in the line, so the appropriate size is a 10 cc syringe. So nothing any smaller than a 10 cc syringe. Too much pressure, okay? In some states, nurses are allowed and are trained and skilled in the proper techniques of inserting a PICC line. So especially in some of the hospitals in Nashville, they have just regular RNs who are trained to insert PICC lines with x-ray assistance, and they do it on a regular basis. They are or can be inserted at the bedside, then without the doctor present. When caring for a patient with a PICC line, you need to know whether it's a true PICC line, which means that the tip of it terminates in the superior or inferior vena cava, or if it's a midline device, which means it isn't in the central venous circulation, but in the basilic, cephalic, or brachial veins is where it terminates. That's the difference between a true PICC and a midline PICC. PICCs definitely have advantages. They have that long-term access to central veins, and they can be left for long periods of time. They provide the safe, reliable route for infusion therapy and blood sampling. Some PICC lines also have antithrombogenic properties, so that blood clot risk and phlebitis are minimized. And they're very cost effective compared with other long-term and short-term central venous access devices. So a PICC line is unsuitable for a patient that may have bruising, scarrings, or sclerosis from earlier multiple venipunctures at that site that you want to use. You should also remember that bedside ultrasound has to be used when accessing a vein, and that it works best when it's introduced early in the treatment, and it should not be a last resort.